Hello everyone. In this video, I will review semaglutide, brand name Ozempic. This long-acting, once-weekly injectable medication was initially approved by the US FDA in 2017 for the treatment of type 2 diabetes. Additional indications were approved to reduce the risk of major adverse cardiovascular events in 2020. To reduce the risk of sustained eGFR decline, end-stage kidney disease, and cardiovascular death in 2025. You will learn about its indications, dosage forms, mechanism of action, pharmacokinetics, contraindications, and side effects. Now, let's dive into this medication in more detail. Semaglutide, brand name Ozempic. This medication was initially approved by the US FDA on December 5, 2017, and indicated to improve glycemic control in adults with type 2 diabetes mellitus as an adjunct to diet and exercise. In 2020, the US FDA also approved another indication for Ozempic to reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and established cardiovascular disease. In 2025, the US FDA approved another indication for Ozempic to reduce the risk of sustained eGFR decline, end-stage kidney disease, and cardiovascular death in adults with type 2 diabetes and chronic kidney disease, CKD. Chemically, semaglutide is a synthetic 31 amino acid GLP-1 analog. GLP-1 refers to glucagon-like peptide with a lipophilic C18, which means have 18 carbon fatty diacid moiety, enabling high protein binding and prolonged half-life. As you can see, based on the chemical structure, it has a peptide structural motif, peptide backbone. In addition, there is a hydrophilic spacer, and then attached with this lipophilic C18 fatty diacid moiety in the end, so which is here. This medication is available as 0.25 milligram, 0.5 milligram, 1 milligram, and 2 milligram for subcutaneous injection. Recommended dosage, initial dosage 0.25 milligram, subcutaneous injection once weekly for 4 weeks with or without meals. Then increase the dosage to 0.5 milligram once weekly. If needed, increase the dosage to 1 milligram once weekly after at least 4 weeks on the 0.5 milligram dose. If needed, increase the dosage to 2 milligram once weekly after at least 4 weeks on the 1 milligram dose. This medication carries a US box warning, risk of thyroid C-cell tumors. This was based on the in vivo animal model studies. Therefore, the risk to cause thyroid C-cell tumors in humans is unknown at this point. Mechanistically, this medication works as a selective GLP-1 receptor agonist. GLP-1 refers to glucagon-like peptide 1 receptor. By activating this GLP-1 receptor like a native GLP-1 hormone, this would enhance insulin secretion, decrease glucagon levels, delays gastric emptying. Pharmacokinetically, bioavailability is about 89% based on the sub-Q administration. Tmax, that's the time to reach maximal drug concentration in the plasma. It's 1 to 3 days. Volume of distribution is 12.5 liter. Protein binding is over 99%. As mentioned, this lipophilic fatty acid chain will make the drug molecule more lipophilic. This would enable high protein binding with albumin so therefore can have a prolonged half-life as well. Metabolism. This peptide analog will go through the hydrolysis via proteolytic cleavage of the peptide backbone. Half-life is about 1 week. Given this is a very long half-life, about 1 week, so therefore if you look at the dosing regimen, it's given subcutaneously injection once weekly. Excretion in the urine and feces. In the urine, about 3% as a parent drug molecule. Drug-drug interactions. Ozempic delays gastric emptying, may impact absorption of concomitantly taking oral medications. Contraindications. History of medullary thyroid carcinoma or in patients with multiple endocrine neoplasia syndrome type 2. Given this is a peptide analog, so therefore serious hypersensitivity reaction to semaglutide or to any component within Ozempic drug product. Adverse effect greater than or equal to 5%, nausea, vomiting, diarrhea, abdominal pain, and constipation. So therefore you can see most of the adverse effects are GI related, gastrointestinal. With that said, if patients they take smaller meals, this can mitigate their adverse effects profile. Finally, this is the key reference which I have used to prepare for today's video. Most of the medication information which I share today are based on Ozempic prescribing information. This document is available at the US FDA drug websites along with the manufacturer website as well. Finally, I want to thank you all so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.